On this episode of WarDocs, Dr. Stephen Ferrara, retired Navy captain and current Acting Assistant Secretary of Defense for Health Affairs, discusses his extensive career in military medicine, the challenges and responsibilities of his current role, and the importance of maintaining readiness within the military health system. He shares insights from his deployments, lessons learned from diverse assignments, and the high quality of care provided in our military treatment facilities, while ensuring the military health system is appropriately resourced and staffed to excel in its mission. Dr. Ferrara emphasizes the significance of teamwork in healthcare and expresses gratitude for the dedication of military health professionals. For further information about Dr. Ferrara and our previous guests, visit our website at wardocspodcast.com. Be sure to follow WarDocs on your preferred podcast platform and subscribe to our WarDocs YouTube channel. The host for this episode is family physician, retired Army Major General, Dr. Jeff Clark.
Welcome to WarDocs, the military medicine podcast. This show brings you a first-hand, behind-the-scenes look into the mission, unique opportunities, and deployed experiences of the entire military healthcare team. From state-of-the-art hospitals in the United States to the most austere environments across the globe, WarDocs has you covered.
Welcome to WarDocs. I'm your host, Major General Retired Jeff Clark, and we're privileged to have as our guest Dr. Stephen Ferrara, Acting Assistant Secretary of Defense for Health Affairs. Dr. Ferrara, welcome to WarDocs.
Well, thanks very much, General Clark. I'm really happy to be here. It's a real pleasure to be able to chat with you and with your audience, the folks that are in the military health system and military health system adjacent.
So thank you for that. So why don't we start with the roles and responsibilities of the Assistant Secretary of Defense for Health Affairs? That will be good for all of us. I know that early in my career, I didn't really appreciate the position or how it might impact me at my level.
Yeah, no, it's a great question, and something I like to share with people when I do town halls and so forth too. And I always preface it just like you did when I was in uniform. I think I generally knew who the Surgeon General was, and that was probably about as far as my awareness went. And so it's a great opportunity to get to share with people what the Assistant Secretary of Defense for Health Affairs, or the ASDHA, does. So the ASDHA is ultimately responsible for the military health system, for all the components of it, both the healthcare delivery, the operational mission, our research and development, and our education and training. So it's a great mission. The ASDHA is the direct advisor to the Undersecretary for P&R, and really ultimately the direct advisor to the Secretary of Defense for all things related to military medicine and healthcare. I often talk about it as the ASDHA as the CEO of a large healthcare system. So we talk about in terms of policy and vision, but also managing a budget. As you know, we have, depending on how you count it, we're roughly 135,000 folks, in the active component, including civilians and contractors. And then when we add in, the other compos, we're well over 200,000 healthcare professionals. So ASDHA oversees the personnel side of things, and then also the budget. So we have what we refer to as unified medical budget in the military health system, which is about $61 billion this year. It's about 7% of the Pentagon's top line budget. So quite a significant part of our defense budget. And so the ASDHA is a bit unique because we hold that appropriation. So, and as I think people are well known to say, that your budget reflects your priorities. So the ASDHA helps inform that. And, we go to Congress. So that's one of my main roles. I meet with Congress, both the HASC and the SASC, as well as the appropriation committees on the House and Senate side, once or twice a month. But I think one of the most important things I like to remind people is, I mentioned before, I'm the direct advisor to the Secretary of Defense. So in that sense, I am the voice of everyone at the deck plate. What I always say, I get to tell I have a great job because I don't really do any of the work. I just get to talk about all the great work that people do. So I'm the voice of folks out there. I'm our advocate. I'm our voice. I'm the one that gets to brag about all the great things we do, but then also advocate on our behalf for the things we need, the resources or the policies that we need. So that's I think most of it. When people say, I'll give a little bit to just the ASDHA oversees the Defense Health Agency, Uniform Services University, and then, like I mentioned, some of our other research and other functions that we do in the military health system. And then, of course, we have the Army, Navy, and Air Force medical departments, which all intertwine.
Thank you for that. I think it would be good to hear a little bit about your background, how you came to join our Navy and Navy medicine, and go on to be a vascular and interventional radiologist.
Yeah, no, it's a fun story to tell. I think, like a lot of folks, I certainly never envisioned that I would be sitting here today. I joined, like probably many people, there's a moment in things happen in current events. So the first Gulf War broke out. I was, not necessarily considering the military as an option, but I had that opportunity to reflect on my family's background. My dad was a Korean War veteran. He was a draftee from an immigrant's family. Got the GI Bill, which enabled him to go to college and form that escalator of social progress. And then here I was, on my way to medical school. And so I thought I would want to give back to people like my dad that had served the country. And so I felt I was going to be in a trauma related specialty, and it was a great opportunity. So the way I knew how to join the military then was the Uniform Services University. So I, had my acceptances, and so I said I'll go to the Uniform Services University as my entree into the military as a kid who was at UCLA. And while I was there, it was an absolutely great experience. Besides getting a great education and a great inculcation to the military, met my wife, and led to a great career. I had chose the Navy because, like I mentioned, I was at UCLA, and I thought, well, I kind of like to continue to be by the water. That was why I chose the Navy. I know I'm talking to a Army general officer here, but I just said, well, the Navy seems like it's in pretty good spot, so I chose the Navy. And then I was a dyed-in-the-wool surgeon when I graduated from USIS, and then I went and did my surgical internship in San Diego. But for me, I'm still pretty bullish on the GMO tour. I know the GMO has largely gone away outside of the Navy, but you probably remember it too. It was a much more common tour for post-internship folks. But it was during that GMO tour, I went to Camp Pendleton, and I was with the 15th MU. I was a force recon surgeon, and I had the chance to sort of reflect on things a little bit and think what I liked. And I had a brief exposure to interventional radiology as a med student, as an intern. And I said, boy, those guys do a lot of what I like to do. They, hospital-based medicine, take care of sick people and they do a lot of procedures. I was a surgery guy. And so I had that opportunity. So that's why I'm always grateful for the GMO tour, because it was while I was deployed. I had to mail my application back, this paper application from Australia, on the way back from deployment to the Persian Gulf. And I put radiology and then to IR, and then there it went. So that was sort of, again, these serendipitous things. I'm sure we all have them. It's turned out to be great choices, and I just had great experiences, and kind of things went from there.
Sure, thank you. I did not have the opportunity to serve as a GMO, but I've had several friends, and they say it's one of the very best assignments they had in military medicine. So thank you for sharing that. Could you talk a bit about a couple of your first assignments after you finished your training and so forth, and how they helped you as a clinician and as a leader?
Yeah, no, I am extremely grateful, and it dovetails well with the last question. I mentioned I went straight from, we were as a dual military couple. My wife is a pediatric nephrologist. She actually retires from the Navy in June, so 34 years later. So I'm actually a military spouse. And so it looked like she would go straight through, as pediatricians often do, and I would. So that's why I chose Camp Pendleton. So we would be co-located, and but boy, it was real. I feel very grateful, because I felt like, while I got a nice foundation at USU in terms of military culture, when I went to the Marine Corps, I really had the opportunity to imprint, I think, as a young Navy lieutenant, first tour out of sort of medical training, on what I found to be, I had great leaders, a really solid sense of understanding mission, understanding readiness, understanding leadership in terms of, the Marines, like the Army, we really focus on that soldier, that Marine is the weapon system. You have to know how they are at home. You have to know, if things are going well for them, because they got to stay laser focused on their mission. And so, we live that every day, and I've always been very grateful, over my career, that I had those opportunities and those role models. So I spent that time, the 2 years with the Marines, then went back, did residency. Again, had great role models. I did a military residency, but then I did a civilian fellowship in interventional radiology, and then I did another civilian fellowship in pediatric interventional radiology. So I really, again, feel very blessed, because I had the opportunity to see some private sector stuff too, and it also made me really appreciate. I mean, I got to see some of the neat things and the pros of the private sector, but also the things that I really liked about the military, and it helped reinforce, a lot of our values and a lot of our things that we do, and the way we're able to take care of patients that isn't always possible in the private sector. And I think that certainly had a big impact on me in terms of, ending up staying for a career. And shortly after I came back from fellowship, I was sent off on the Mercy for a humanitarian assistance operation, disaster relief operation. And things just kept going from there.
Yes, you mentioned that. I know you've been deployed several times, both in combat and humanitarian missions. Can you talk a little bit about those deployments and how they have shaped you?
Yeah. They've shaped me a lot, and especially in this role. I remember my first meeting with military medicine leaders that we have every Thursday, the Surgeons General and the head of the DHA. And when I sat down, I mentioned this role is a lot like being a CEO, and so one of the things is important for people to know your vision and your priorities. And I really prioritize readiness, and which I think hopefully we all do. And we have a challenging mission, because we have a healthcare delivery mission, but we also go to war. And we're in an interwar period right now. So it's maintaining that focus. But I tell you, those 4 deployments I did in combat, disaster relief, when I went on the Mercy, as I mentioned, I got called on, that was for the massive tsunami that occurred on December 26th, 2004, if people recall. And it was really apocalyptic. And of course, we were all watching on the news, and I was assigned to the Mercy, but in those days, it was like a platform. I worked at Naval Medical Center San Diego and didn't really do much on the Mercy. It didn't really sail or anything then. And lo and behold, on a Saturday of a holiday weekend, it happened to be New Year's Day, I was taking Christmas lights down in my front yard, and my wife comes out with the phone and says, "Hey, the Mercy's on the phone." And I said, "Oh, that's interesting." And so I take the phone, and they said, "Hey, the president says we're going to Indonesia to Banda Aceh." And I said, "Okay." And I said, "When are we going?" And they're like, "Now." And so it emphasized, and we left in 4 days, which I think is pretty impressive. And we didn't know when it was the first mission of its kind like that. We worked with NGOs. We ended up staying gone about 6 months. But again, it reinforces that, you never really know. You have to be ready all the time. You can't cram for readiness. We left on 4 days notice and did an incredible mission. Then you fast forward. I mentioned to you, one of my primary reasons for joining the military was because my dad was an infantryman in the Korean War, and I thought I wanted to help serve folks like my dad. And here I was. I had the benefit of getting to become very specialized. And then as these wars came along, they didn't have interventional radiologists on the battlefield at the time, and so I was volunteering to go to Iraq or Afghanistan, and they said, "No, we don't have interventional radiology there." And by that time, I was a residency program director in San Diego and pediatric interventional radiology. They said, "No, you're too specialized." So as the wars kept going on, and the Army was really stretched thin, because obviously, as you were in the thick of it. This IA thing, these individual augmentees started with the Navy to help augment in this landlocked country where we didn't have as much naval stuff. So they, one day they said, "Hey, would you be willing to go to Afghanistan as a general medical officer with the Army?" And by then I was a Navy commander, and I said, "Yeah, absolutely. I loved my time as a GMO before with the Marines. I'd love to go with the Army." And I always pledged I would go serve in combat. So that's how I got to go to combat. I went with the Army. I was in a BAS, part of the 2009 surge. And it was one of the most fulfilling tours and experiences of my life, like I think most of us have the opportunity to do. I volunteered at the Roll 3 in Kandahar because I was nearby in the BAS, but I went out on patrols with the soldiers I supported. So function as a medic, function as a GMO, and function as a radiologist and even an intervention radiologist. So in that sense, I feel very grateful to have seen so many of the missions that we've gotten to do. And then again later on went to Vietnam as part of a team when we were commemorating the 20th anniversary of normalization of relations with Vietnam in 2015. And of course, by then, geopolitically, Vietnam was more our friend and China less of our friend. And so we were courting, so it was great to be part of that diplomatic tool that the military serves to help project our foreign policy overseas. So again, a fantastic opportunity to go work with our Vietnamese partners and do a lot of medical training and a lot of medical care in that soft power global health engagement kind of way. So yeah, really just a very, very fortunate, very blessed career.
Yes, sir, indeed. And as you mentioned, your wife is a naval officer, a medical corps officer, and she's deployed several times, as I understand it. Could you talk a little bit about that? I think between the two of you, you have multiple deployments. Talk about how you made it as a dual military family.
No, that's right. And, we do. We have, 8 deployments, but yet 8 deployments, 59 years in uniform, 2 kids born at MTFs, fortunately well adjusted and, really succeeding. And, but it is hard. And I can tell you as a person, I talk about this a lot, and it's very personal. It's from the heart. I think military families, they are the unsung heroes of what we do as military, active duty and reserve and other kind of personnel, people in uniform, because minding hearth and home while the other person deploys, and I've been in both situations. I find it a lot easier to be deployed than to stay home. And so I'm very grateful, that my wife supported me and I supported her, and, we always made it work. But, it is a challenge. And, but it's very gratifying. And I think for both of us, we appreciated the opportunity for our children. I think there was a conscious, certainly a subconscious, not a conscious effort to say, we wanted to instill in them the values that were important to us, which is about public service. It's about service to service members, to our country, service member, taking care of ill and injured. Again, I talk about it a lot. I think as healthcare professionals, we have one of the best missions in general, because whether you're in uniform or not, you have the opportunity to take care of people in their most vulnerable time, which is truly wonderful. And then when you serve your country in uniform, that's an incredibly rewarding calling. So when you do both, when you serve the sick and injured and serve your country at the same time, what a great mission. So we've been, again, we've certainly sacrificed, missed a lot of birthdays, missed a lot of special occasions, but I think we wouldn't do it any other way.
So thank you for that. I've heard it said there is no greater patriot than the family of an American service member. And you just laid that out very well. Thank you for that. And you've served with our Navy for 25 years, retiring in 2015, and you continue to serve. Could you tell us a little bit about the jobs you've had since retirement?
Yeah, no, yes, that's right. So I retired, and when I retired, I knew I wanted to stay in public service, and so part of the reason I retired was because I wanted to. It was a big thing for me when serving in combat, between the disaster relief and combat mission, and seeing how we, again, as I mentioned before, projected policy. And I felt there was a shortage of both physicians and people with military service in Congress. And I think well-intentioned people, but just there, especially at the time, there was a lack of experience there. So I felt a sense of urgency. Again, I think all of us, when you've served on the battlefield, you're taking care of wounded, there is always a very strong sense of urgency. So I had the opportunity, again, while I was active duty, to dip my toe in the pool, if you will. And I did a Robert Wood Johnson National Academy of Medicine's Congressional Health Policy Fellowship. So I worked on the Hill for a year to see what it was like. And it was a very rewarding, great experience. So first thing I did when I got out, I went back to my home state and I ran for Congress. As in this role, I'm a Republican. And so 2018, it was mid-year, midterm election. Won the primary, didn't win the general, but that's a bit. The point was to help get military folks, get veterans, and get healthcare leaders into Congress. And so once I had done that, I said, okay, well, how else can I continue to serve? So basically, I came back and I ended up working for this. I wanted to stay in the national security apparatus, so I did some time working with the DHA, actually doing clinical operations at the NCR, and then worked at the CIA. So while my security clearance was going through and so forth at CIA, I ended up going over to CIA and I was the chief medical officer there, which again was just a really valuable and rewarding tour, and was doing that right up until I had the opportunity to take this role. But it's important for me to say all along, all throughout all the time, I've always been clinically active. That's something that's really important to me. I remain clinically active now, and that was always working at Walter Reed. And so, always having the opportunity to take care of service members and their families at Walter Reed has been really, again, a great point of gratitude for me to be able to do that.
I agree. Staying clinical, it keeps us grounded, reminds us of who we are and why we do what we do. And you're now serving as Acting Assistant Secretary of Defense for Health Affairs. What was your biggest aha moment when you first took the position?
Yeah, so I think a few things. Like I said, I think we are I mentioned earlier, in the interwar period. And as I said, it's because I've been in the national security apparatus throughout my post uniform time and been working at, a major MTF. I've been able to sort of see that this is a very pernicious time, as you know. They even have a name for it, the Walker Dip, the period between wars when we were doing so well on our survivability. I mean, our combat casualty response and capabilities is just, we're the best in the world, best in history. But what inevitably happens during peacetime is we lose corporate knowledge, we lose some of those skills, and that's repeated. That's not anybody's fault. We see that Walker, who named that, was Vice Admiral and Surgeon General of the British Armed Forces. He did a thing going all the way back to the Napoleonic Wars in the early 19th century and saw that this is a pattern that continues to happen. So for me, coming into this role was to say, how are we going to avoid, how are we not going to fall for the Walker Dip? And how are we going to keep our eye? It's not easy because there's so many competing priorities, but to say we have to put readiness and we have to put warfighter support and war fighting at the forefront all the time. And so for me, that's been in the 4 months or so I've been in the role where we've really focused, and I think we're doing a lot of great work, from things like the Joint Trauma System, to all the work with DHA, all the work with the COCOM commanders, the COCOM surgeons, Joint Staff Surgeons, Surgeons General. I think we're really rowing in the same direction and really laser focused on ensuring that it's a sacred promise we make to people who raise their hand and go into harm's way for the country. And what they do is they expect us to be able to be there to give them the best chance of survivability. And it's a real force multiplier because they will take risk that they wouldn't otherwise take if they didn't know we were there to back them up. So we really do strengthen the hand of that commanding general or that admiral by being able to know that they have that opportunity. So really, I think not only is it the right thing to do, it gives us a really valuable strategic edge.
I know you've made several visits to MTFs, both here in the States and overseas. What are your first impressions?
It's always the people. I'm inspired. So every time I go, I wish I could go all the time. I genuinely wish I could meet every single. I talked about the hundreds of thousands of professionals we have across the globe working in the military health system. I wish I could meet every single one of them because they're what energized me in this job. Because one of the things I am always, try to lean into acknowledging is this is a challenging time in terms of, as I mentioned, the interwar period, the Walker Dip, resources are constrained. We've had a lot of, personnel issues, over the past few months that have caused uncertainty and anxiety on the behalf of the workforce. And so that's why it's so important to me to go there and number one, explain what the ASDHA is, who they are, what I do, how I'm advocating on their behalf, but also to see what they do and how they continue to execute just with such perfection and such grace, even in times of competing priorities and decreased resources. The number of times I hear people say, "Hey, sir, this, we just find a way to get it done. We just," and with a smile and with even a sense of pride. I honestly think they actually rise to the occasion and they rise to the challenge. And it always reminds me when I'm back here, we're bureaucrats, we're sitting back here and in offices at conference room tables and doing stuff. And I'm always thinking, we're not, at the end of the day, we're not the ones that are responsible for the patients' lives and the families' lives. It's those people down there at the deck plate out in the field. And so we have to support them. And they're doing it. It gives me the energy to be able to go down the hall to, the under or to the secretary and, put my fist on the table and say, we got to have this because our folks need it.
So I know you're familiar with the recent leapfrog survey of patient safety that was done on our MHS, and we've been participating in that survey for 3 years and doing very well. Would you like to share a little bit about the recent survey results?
Yeah, I am so proud of our team. So Leapfrog it's not a military, it's a private sector civilian firm that, or system that nonprofit that basically rates hospitals on quality and safety. And our system is basically like double the national average in terms of an A grade. This isn't like, going to the food place. And if they don't have an A, you should probably keep going. It's hard to get an A. There's no grade inflation here. And so our teams are doing amazing work. We had 16 sites getting A's, which is, again, well more than the private sector does. And I think we're at something like 73% and they're at 30 some percent. And so, again, just something really that I'm very proud of because, again, we have this dual mission I talk about. The private sector, and I love I spent a lot of time working in the private sector too. We didn't talk too much about that, but I've lots of experience in the private sector. Private sector is great and does a lot of things really well, but as I mentioned earlier, they don't have to go to war. They don't have readiness requirements. They don't have combat requirements. And they can, if they need more people, they can pay more money. We have a lot of constraints on what our levers are. And the fact that our folks are doing so well and outperforming the private sector in patient outcomes with quality and safety than the private sector, despite, all the challenges that we layer onto them, is an incredible source of pride. And it also, I hope our patients see that too, both our military, members, our military families, our retirees see that the military health system is a great place to get your care. We provide incredibly high quality care, whether it's how Leapfrog, attests to it, whether it's our graduate medical education programs. We have a incredibly high first-time board pass rate. Our fourth-generation platforms are second to none. We turn out 16,500 enlisted healthcare professionals every year doing amazing work. If we were private, we'd be the biggest school or university doing that kind of work in the world. And they do, again, not only just working in a controlled downtown community environment, they're doing it in the field, they're doing it overseas, they're doing it with all the limitations and all the extra challenges that are, normal to military folks, but not normal to healthcare.
Yes, sir, indeed. Similar to that, that's the reason I hung around for so long. I just appreciated the challenge of being in a medical system that went to war, the challenge of maintaining readiness, providing high quality health care at the same time. So you made reference to the budget, and as you know, our MHS budget has been essentially flat for about a decade. There are less service members and less civilians serving in our MTS than there were in, say, 2018, 2019. What do you see as the way ahead to ensure that our MTFs are adequately resourced to do their mission?
Yeah, that's a great question. And it's again a topic I talk about a lot because I try not to sugarcoat it. I try to, I make sure I think our folks know it, and I acknowledge it. And I'm a loud voice both down the hall. And when I said we're 7% of the top line budget, not that long ago, we were 8.5% of the Pentagon's top line budget. And, we changed administration. So I remind, my leadership that we used to be a bigger percent of the Pentagon's top line budget, and we're doing more with less. And I remind them what the rest of the healthcare inflation is that we haven't been doing. And our people are doing more with less, but I don't like to see that as a sustainable thing. I absolutely think we have to prioritize things like efficiency, and that's just good. That's just what we do. That's good governance to be efficient, to be a good steward of the taxpayer dollars. That's in our values. But also, we're doing a lot of things to try to become a little more self-sufficient. There are revenue opportunities we're doing where with partnerships with more with the VA, where we help take care of veterans, which helps our readiness because our high complexity, high volume care, where it makes sense at some of our bigger medical centers, our Brooks or our Walter Reeds or our San Diegos or places such like that, where we can help take care of veterans and keep our sets and reps up, and helps the VA by giving access to veterans to high quality care, and then they pay us for it, so that's extra money we can get. We look at other opportunities, again, same thing with the Medicare population, where we talk about where it makes sense. Can we bring in some Medicare patients, because again, we can help. God helps those who help themselves. And so when we can take care of, and a lot of those folks, they really want to come to the MTF. That too. You've commanded Walter Reed and many other places, and those folks, that's part of the military family. And so, I'm looking at it as saying, hey, how can we make sure we have the staffing and the supplies and the equipment to make these places succeed, of course, and not whipsaw, people in and out, but then be able to do that. It supports our GME and our fourth generation platforms, and it supports our skills readiness, makes patients really happy, and they have great outcomes. And by the way, Medicare will pay us for it. So that can help close the gap as well. So those are some of the things, but also, I go to Congress, and I've talked to Hask and Sask within the past couple of weeks. And I don't I don't let them put it solely on us to say, well, everything is, on us to make ends meet. I remind them that, part of being, representing their folks and being on an armed services committee is to ensure that they owe their constituents that they're doing good governance of the military, including the military health system. And so I remind them that they own a piece of that responsibility. And my job is to help tell them where some of the gaps are, and remind them of those kind of things, like we've been flat for 10 years. And I'm proud to say they've been hearing it. And so you might have seen in the House version of this current bill, the reconciliation bill, they added over $2 billion extra money to the military health system. That goes a long way for us, because we do, again, such great work, and our folks are so judicious with the dollars they're given, that we're pretty close to being solvent, but we're not quite there. And there are things that we do. I remind folks that one of the great things we have is there's amazing drug development and drug discovery that's occurring. This is a wonderful time to be in medicine and to be a patient because of the great things we have, but they're expensive. And so we want to and will continue to provide those great therapies for our patients, but they do cost money, and they tend to be costly. So, and they're not easy to budget for. It's not only the way we budget, but because they're new, and you couldn't have predicted them a year ago or 2 years ago. So when we can bring in those extra dollars from these creative ways of generating resources, while I'm going and saying I need a higher top line, I think it really sets us up for success.
So thank you for that. And again, as you said, Congress has the purse strings, as we say, and for them to understand our military system is especially important. So what do you see going forward in the next 150 to 180 days, your vision for our MHS and priorities?
That's a great question, because now that we're about 120 days in, when I've talked to the team, I think that's, we've gotten the foundation. As you know, when a new administration, we always talk about the first 100 days or so. So I think we've laid out a vision. We've talked about I just shared with you some of the initiatives like the Medicare, but one of the big things we're doing, and to expand on stuff we're doing with the VA, to try to, again, where it makes sense to implement, to basically bolster some of those partnerships. And we have a lot of them, but what I want to do is make them more mission focused. So we have about 193 resource sharing agreements between DoD and VA at hospitals around the country, and around the world, primarily around the country. But what I want to do is make sure that these aren't all like 193 points of light that may not necessarily lead to things that are of value to them or to us. So to look at it in a more holistic approach and say, you heard me say my priority is readiness. So I want to say, where can we do stuff? Look at it at an enterprise level. And so Dr. Line, whom you know, has been really helping take the lead on that, working with the VA. I'm meeting with them next week. So now in this next quarter to 2 quarters, we are going to be working hard with the VA on, we have sites sort of tentatively identified that where that's going to make sense, where there's good opportunity for synergy. And so we're going to start implementing those things. We're going to look at ways where we can do those kind of things where our folks will get more training, more reps. The VA will get better access for their veterans. I mentioned things like we're going to be bringing in more Medicare patients. Part of what that involves, though, is making sure that we have a stable workforce. And so, again, one of the benefits of being in P&R, personnel and readiness, is they kind of control how military members move around and everything. That's what one of the things the Undersecretary for Personnel and Readiness does. So talking about how do we make sure that we don't, cut off our nose to spite our face and say, boy, we had really great skill sets at this place and we moved them and now we lost a whole, not only that function, but there's like a penumbra around that because, that interventional cardiologist was important because not only they were doing interventional cardiology, but they were supporting surgical and medical specialists and care that without interventional cardiology, now all of a sudden you lose those things too. So are we doing those things as intelligently and as strategically as we could? So we're looking a lot at those things. Are we putting people in the right place? Are we keeping them there the right amount of time? So I think that's as we come into the summer, into the early fall, we're going to be sort of codifying a lot of that. We've sort of figured it all out. Now we've got to start implementing.
Certainly, no question about it. From a readiness perspective, SEPs and reps, as you mentioned, is critical. When I was at Walter Reed, we had a great relationship with the local VAs, but one of the most rewarding parts of it was that the veterans who got their care in Walter Reed, they were just happy as they could be to be there. They got great care and they were around young service members, say in serve and MAM. So it was a great experience for all of us.
Absolutely. The cultural continuity can't be overstated because it really, and our folks love taking care of them. There's something to be said when you refer to your patient as, hey, staff sergeant, they like that. That has a lot of meaning to them. It has a lot of meaning. That's a rank they earn. And when they go out to St. Elsewhere, nothing wrong with St. Elsewhere, but they're much more of a, that part of their life, that part of their identity is not necessarily as clear to folks that are outside of this, this military family.
So thank you. As we start to wrap up, anything else you would like to share as we start to close?
Yeah. Well, there's so many things. Again, I appreciate the opportunity to talk to you and your audience. First and foremost, I never want to miss an opportunity to thank all the people doing the work. I always say I don't really do any work. I just kind of talk about their work, talk about everyone else's work, and get to show it off and get to advocate on their behalf. So I feel like I get to be sort of the skimming the cream of the hard part of this of the military health system mission. So I want to thank people. I know it's not easy, and some places it's even harder than others. So I want to thank everyone in the military health system, and importantly, their families that are supporting those folks that are working. And that's not just our uniformed folks, it's absolutely our uniformed folks, but all our civilians. I know they've been going through a lot over the few months to, hopefully ensure their jobs are secure. And we're working really hard on trying to make sure that they can have confidence in that. And our contractors as well. We couldn't do it. It takes the whole team. Healthcare is a team sport. So again, I thank everybody, and I want people to know that this is, for me, this is I'm incredibly grateful to have this role, because the military health system is really the defining institution of my adult life. This is a labor of love for me. It's not disingenuous for me to say that I will advocate for people. I won't serve in this role as a caretaker. I really will make things better for folks. And if I can't make things better, I'll step aside for somebody who can. But I appreciate the suggestions and the input people give me. I try to communicate regularly with the workforce. Please keep the suggestions coming. And I look forward. I've got 3 trips coming up in June, so I'm going to get to meet a lot more folks. Hopefully some people watching, I'll get to meet you, next month or the months to follow.
Sir, enjoy your travels, and thank you for your time today. Our WarDocs guest has been Dr. Steve Ferrara, Acting Assistant Secretary of Defense for Health Affairs. Dr. Ferrara, I want to thank you and your family for your decades of service to our nation, and thank you for being a guest on WarDocs. Be safe, and may God bless.
Thanks, John Clark.
Thank you for listening to WarDocs. We sure hope you enjoyed it. WarDocs is a nonprofit organization supported by donations from listeners like you. Please follow and subscribe to our show on whatever platform you consume your podcasts, and rate and review this episode, and share the show with your contacts on social media. Find out more information about our show, our guests, and how to become a member of Team WarDocs on WarDocsPodcast.com. Thank you for your support. If you like war stories and medical drama, WarDocs has you covered. Spread the word.